So, Dr. Ivo, you've been teaching needling courses for quite a long time, right?
Yep,
So, you've been teaching dry needling and acupuncture courses, is that correct?
it is. There's not a lot of people that teach both, but I've had the fortuosity to be able to teach both. I've been teaching acupuncture and dry needling, well, acupuncture for about 20 years, and dry needling probably for the last 12 or so. Um, One of the questions I get all the time, though, is like, what's the difference between acupuncture and dry needling? So, first of all, acupuncture just means puncturing the skin with a needle. Okay, so if I'm puncturing the skin with a needle, I'm doing acupuncture, no matter what I'm doing. Okay, if you're getting an injection, it's a form of acupuncture. It's just wet needling because there's something in the needle that you're sticking in, as opposed to dry needling, which means the needle doesn't have anything on it. Needles which we use for injections and things like that are hollow. They're like a pipe cut on an angle. They're designed to cut tissue, so when they go in, we can introduce a medium or take something out of the body. Whereas an acupuncture needle is rounded actually at the tip, and if you look at it under a microscope, it's rounded. It's designed to go around structures, which is why when we do acupuncture, people aren't bleeding all over the place most of the time and things like that. Although sometimes you can hit a capillary or things like that. The main difference between acupuncture and dry needling is acupuncture, or dry needling is a form of acupuncture. Acupuncture vernacular is generally using a meridian-based system in the body, so you're stimulating different points on different meridians in the body for the purpose of moving energy or chi throughout different areas of the body. That's sort of the Eastern definition of acupuncture. Dry needling is more traditionally and originally taught when it was first brought over to this country in the early 90s. Basically, we're going after trigger points in muscles, hot spots in muscles, irritable points in muscles that are creating spasm and stuff like that. And by sticking the needle in, we reset the gain of the muscle there. It has to do with Golgi tendon organs and muscle spindles and things like that. So dry needling purposefully is going after hot spots in muscles. However, again, like I said, all acupuncture or all dry needling is a form of acupuncture. There's also what we call neuromuscular acupuncture or functional dry needling. And what that is not necessarily just going after hot spots or trigger points in muscles, but more stimulating a muscle to get it to function more appropriately. So a lot of times if we stimulate the origin and the insertion of a muscle, we can get that muscle to fire better. And we see that a lot with people's glutes and things like that, where they're having trouble with lower back pain. They're not using their glutes and they're substituting their lower back muscles as their hamstring muscles. So by needling the origin and insertion of those muscles, a lot of times we can get those muscles to function better. So semantically speaking, dry needling is more functional, more looking at physiological function or something that's working or not working, whereas acupuncture is more using a diagnostic meridian system, more whole body. We often do a blend of those things at the office here.
Awesome.